The state of Illinois has just passed a new law to ban the use of AI in therapy. How are they going to regulate these companies? It only targets us, psychotherapists. What kind of problem does it solve?
You could utilize it to do a better job. That's not being interrupted here. The whole point is to make sure we have a therapist in the room.
Are you thinking at all, or your peers talking about these big tech companies and how you can hold them accountable for this as well?
Millions of people are using these chatbots all the time. The target here is those designed companies, those marketed apps that are specifically calling themselves therapists.
Why does the law explicitly exempts religious counseling and peer support?
This is a new law. It's inevitable that we're going to have to make changes. When we did that, some of the groups and types of concerns that we were hearing about, it was not targeting religious counseling. So there are a variety of things that I think moving forward, just like any law, we're going to look to improve it. This was our first effort at it, and it's being used as a model around the country.
Hello, welcome back to my podcast relating to AI. I'm your host, Paula Fontenelle. I'm a journalist and a licensed psychotherapist. So the state of Illinois has just passed a new law, first one here in the US, to ban the use of AI in therapy. So you might be asking, how are they going to regulate these companies? They won't. The law actually doesn't even mention the AI companies. It only targets us, psychotherapists, directly. And my question is, what kind of problem does it solve? And to answer some of these questions, we have our state representative from Illinois, Bob Morgan. Bob, thank you so much for being here with us. He is the guy who sponsored the law.
It's great to be here with you. Thanks for having me. And just to jump in, there are two aspects of the law. One has to do with what you as a therapist can and should do. The reason that we started there was because what we heard a lot from therapists is that AI is now ubiquitous and a part of your practice. It's a part of your care in your profession. You're using it for note-taking. You're using it for research. And so there's nothing in this law that prohibits that, but it talks about that because previously there was nothing in the law about what you can and cannot do. The second part, which is really the target, were the companies, AI companies, that are holding themselves out as a therapist, as a psychotherapist, as a social worker, when it's just a bot. It's a company without a therapist, without a licensed professional behind that work. So as an individual who's looking for help, sometimes in these really critical moments of need, they might be turning, and they're probably looking online in the wee hours of the morning when they need their support the most, and finding something that says, we can provide you the therapy 24/7. We're here for you. And somebody who didn't know better wouldn't understand necessarily that there was no psychotherapist on the other end of that AI. It's just a program. It doesn't understand, it is not properly trained, it is not properly experienced and accountable to good or bad advice and recommendations in therapy that it might be giving.
Yeah, but I read the law, the full thing, and it hardly ever talks about the company themselves. It's very specific about what we can do, what we can't do, the violation, how much we'll pay, like up to $10,000 per violation. So it's very targeted to therapists, what we can use it for and cannot.
So a therapist who's licensed as a licensed therapist in Illinois would never be subject to that fine. A therapist can have inappropriate, unprofessional conduct, but the therapist is never going to be issued a fine if they're properly licensed. The whole point here is this is not a new concept. 10 years ago, 50 years ago, somebody could set up a shop in a storefront and say, I'm a therapist. Come see me and pay me $100 an hour. And in fact, it's not a therapist. It's somebody who has no training whatsoever. The state of Illinois has always been able to go after that person for the $10,000 in this case. That's what this is doing. So a licensed therapist under the state of Illinois, for somebody who's properly licensed and trained and has a state license, is not going to be issued any kind of fine for practicing as a therapist. This is targeting a company or a person who holds themselves out as a psychotherapist, but really isn't.
So let's go into the law itself. What does the public need to know? Because it goes, and I'm going to read here some of the things that we therapists can use AI for and can't. So you cannot, it says, you cannot use it to make independent therapeutic decisions. What does
Right.
that even mean?
So the easiest way to describe this is what your practice has always been. You cannot bring in somebody who is not a licensed therapist in your practice and have them come in and sit in a room with Bob Morgan or whatever patient and act as a therapist and provide recommendations and therapy decisions. You would never handle your practice that way. You would only
No,
hire and
no.
deploy somebody who's licensed. That is the exact same thing. So a therapist cannot offshore and delegate their responsibility to a software program. That's
Mm-hmm.
what this is about. There's the possibility of a therapist really just phoning it in and saying, you know what, I'm not going to show up to work today. I'm going to use my AI therapist today to do the work that I'm going to bill for. And in fact, as the therapist themselves, he or she's not going to really know what's happening. They're not going to have supervision and oversight. That's what that's trying to address.
How about independent therapeutic decisions? I was thinking, because as I was reading the law, I think we have HIPAA compliant apps now that we can use therapists, for example, for note taking. And
Correct.
we are, yeah, and it transcribes the note, it records the note. Can we still use that for that?
Of course. The what that's trying to get at is, again, independent therapeutic decision from the AI as opposed to you as the
Mm-hmm,
therapist. You can use, that's why we're explicit in the law about being able to use it for note taking and being able to
mm-hmm,
use it for other aspects of being a therapist. It cannot stand in your shoes. You cannot delegate all of your independent decision making to a software
mm-hmm,
program. You
mm-hmm,
can use it, you can utilize it to do a better job, and many therapists around the state and around the country already are. That's
mm-hmm,
not being interrupted here. The whole point is to make sure that we have a therapist in the room. A doctor cannot delegate to a non-doctor to provide surgery. This is
mm-hmm,
the same issue. You have
mm-hmm.
to have the responsibility and the accountability for your work, as you already do. So this is really not a new concept. You can't bring in somebody off the street to sit in your office in your chair and bill that as therapy if that's not an actual therapist. And
What
that's really what this legislation
Mhm.
does.
What about the bots? We already have some apps that are, for example, CBT. It has the whole framework, the conceptual framework, and all the skills come from CBT. It's trained on CBT. Many apps like that. Can those be used?
So you can use it so long as you are the one reviewing whatever that AI comes up with. Again, that's where the consent comes into
But
play.
it's not possible. This is a patient using it. How can I be with the patient the whole time they're using the app?
Oh, I thought you were referring to if you as the therapist were deploying the app. If
No, no,
somebody,
no. Someone
so
using
that's
it.
really, that's the second element of the legislation, which is making sure that a company that is holding itself out there as a therapist, but no licensed therapists behind that company, that's where that fine is going to happen. That's where the
Mm,
Illinois Department of Financial and Professional Regulation is going to intervene and shut
mm,
down that app.
mhm. So the violation is for the app,
Correct.
not for me,
Right,
because
unless
it
you as
says
a therapist are
uh,
utilizing that in your own place, but that's
mhm,
not what we're seeing. What we're
mm,
seeing is that individuals are using companies and apps that are holding themselves out, holding itself out as a licensed therapist. And we're not
mm,
penalizing the patient. People are looking for help. People are struggling to get access to therapy. There's not enough therapists, there's not enough social workers. Our mental health, behavioral health needs are way too high. It's not
mm,
to penalize the individual looking for help. It is penalizing a company that is holding itself out as a therapist when it's not.
mm.
That's what this law is all
How
about.
are you going to detect these violations? Is this report driven? Are there going to be audits? How is that going to happen? Because even even something like chatbots like ChatGPT, millions of people are using these chats every day for therapy all over the world. How are you going to detect this kind of violation? It doesn't specifically say this is a therapeutic app, but that's what's
Right.
being used for.
Yeah, and so that's a great question. There are two parts here. One is those companies that are designed as and marketing themselves and itself as a therapist, as an AI therapy bot. There are a number of companies that are doing that. That's the target here. The second question is not really addressed by this legislation, which is what should ChatGPT, OpenAI, what should those companies do if somebody says, I want to commit self-harm. I want help to do that. And that is a different question that I think the whole world is grappling with at the moment.
Absolutely.
As you mentioned,
Yeah.
millions of people are using these chatbots all the time. The target here is those designed companies, those marketed apps that are specifically calling themselves therapists and therapy. Again, when you really pull back, that's no different from what we have 10 years ago. You have calming exercises, you have relaxation studios, and that's not regulated. But the moment you start putting a sign up that say you're a therapist, the moment that you start diagnosing individuals and prescribing to individuals, but you're not licensed, that's not a new concept. The state of Illinois and every state in the country has always regulated and prohibited that. This just extends that concept to AI.
Hello, it's just a quick reminder to let you know that you can also participate, be part of this podcast. So if you have a story to share or an insight about AI, please send me an email to paula@relatingtoai.com, and please do not forget to subscribe. Thank you. What about the apps? For example, we have apps that are DBT skill building, journaling assistants, so many anxiety tools. And many times we prescribe those, we suggest those to our clients. But of course, we're not there with them when they use it. So we can't be held accountable for the app itself and the kind of service it provides. Can we still do that? Even mindfulness apps, because some of the theoretical frameworks like DBT, we use mindfulness as part of that.
Right.
Does that cover this kind of app?
Yeah, what I would say is if you're the state of Illinois and you're the regulator, you are going to say to a therapist like you, say, you are responsible and accountable for your recommendations and your prescriptions. If you are recommending to your client and your patient to do something, you are responsible to know what that is. I'm not licensed and trained and experienced in diagnosing, prescribing medicine. If I were to do so, Bob Morgan, I should be held accountable for that because I don't know pharmacology. I haven't been trained in any number of aspects of pharmaceutical work. As a therapist, of course, if you go to psychiatry, when you start talking about prescribing, that has very specific requirements under the law where ultimately you are the one already responsible for that. That is what you are trained in school. That is what your continuing education is about. And that is what your licensure requires. So if you start recommending an app, you really should. This is me speaking. My assumption is that the state of Illinois is going to come to you, Paula, and say, you prescribed this app. Had you done any research to know what that app is? This app is causing self-harm. Were you aware of that? Because that, in my experience, that's where you're going to run into issues where you say, well, I didn't know. But you as a therapist and you as a licensed professional are expected to understand what you're prescribing.
Yeah, I'm just thinking here with the mind of a therapist in Illinois right now, I would be really afraid because the truth is all these apps are incorporating AI. And the moment you do that, we don't know what's going to happen. We know about AI hallucination. We know that we can lose track of what it does. So maybe what would you say to a therapist who asks this question in the state of Illinois today?
I would ask you as a therapist, how comfortable are you prescribing something where you don't know what the outcome is going to be?
Yeah, that's a great question.
And again, I think it's really important to stay on track that is not a new question. And that is not the advent of AI. That is any kind of prescription or recommendation for your patient. It is the expectation that the licensed professional is going to be trained and experienced and understand, be able to articulate the risks and the benefits to their patients. That's why we empower you and physicians and healthcare practitioners to be able to do this work because you are trained in it, you are experienced, you understand the risks and the benefits. And it's on you to train and to share that information with your patients. That's what I would say. So back to you. Are you comfortable prescribing an app when you don't really know what the app's going to do for your patient.
Okay. The other question I have is, why does the law explicitly exempts religious counseling and peer support? First of all, what is peer support? Is it
Yeah,
like, do you mean support groups, or what does that mean? And why are they exempt of this law?
yeah. Great question. And so this is a new law. It's inevitable that we're going to have to make changes. When we did that, that was some of the groups and types of concerns that we were hearing about. It was not targeting religious counseling. That really wasn't the target of this legislation. And separate from that, there are situations where we do want to regulate. And so this legislation tried to find that balance. But we've heard since then concerns about peer support. We've heard concerns about the ability to continue to do research on AI in therapy. And so there are a variety of things that I think moving forward, just like any law, we're going to look to improve it. And this was our first effort at it, and it's being used as a model around the country. But I would never say, as I've never said about any bill I've passed, that it's perfect, and we're going to look to improve
Yeah.
it.
Yeah, good. Because when I read it, so that creates a very uneven field. Because if someone is vulnerable, and I mean, our profession is already it's so regulated. So this is one more law for us to really be able to follow, and more regulation. But I'm thinking about someone who is vulnerable. Of course, it would be easier for them to go to unregulated fields. So it just creates a very uneven environment for us therapists.
And I know I'm repeating myself. I would say that has always been the challenge for therapy and behavioral health, where we have individuals like yourself and others who've gone through years of school, years of exams, years of training, and that professional experience makes you who you are and your value to a patient. And also, there's only so many of you.
Mm-hmm.
We have so many people that are struggling with mental health that are afraid to go to a therapist. They're afraid to ask for help. They're afraid to have their insurance have to cover it. They're afraid to let their family know. And so it's completely anonymous and private to turn to their cell phone, which is why this is not going to get easier. It's going to get more complicated.
Mm-hmm.
But again, not a new concept.
Mm-hmm.
Lack of access and workforce issues have existed for a long time.
Mm-hmm.
And that's why this legislation is trying to create some guardrails around what we have seen indisputably causing harm to individuals. That's when the state is going to step in.
Mm-hmm. The other question is on Section 20. It says an individual, corporation, or entity. So I want to stay there, corporation or entities. And my first thought was like hospitals or big clinics. They may not provide, advertise, or otherwise offer therapy or psychotherapy services, including through the use of internet-based AI. So I'm thinking about many hospitals around the country
Only if they
today.
are not licensed therapists. So a hospital is going to have
Mm,
a social worker on staff or somebody who's going to be properly trained for therapy services. So that
mm-hmm,
hospital is already under state law allowed to market and do what they do.
mm-hmm,
This is
mm-hmm.
intended, so it would not apply to a hospital because a hospital is going to have somebody on staff who's licensed and trained.
No,
This would
no, but I
apply.
was going to say, let me just finish, because I was going to say
Yeah.
some of them, they even have like iPads today with these apps for mindfulness apps, DBT apps, and sometimes they hand it to the patient. Can they still do that?
As long as it's under the supervision and care of a licensed
Mm-hmm,
professional, absolutely.
mm-hmm.
The issue is
Okay.
when they don't. A hospital is already incredibly regulated in so many different
Yeah.
ways, and they're going
Mm-hmm,
to only do that with a licensed professional who's under their care.
mm-hmm,
If you're admitting somebody, especially inpatient, they're under a variety of different practitioners' care. That is the way it works today. That's not really a
mm-hmm,
new concept. Now, if you have
mm-hmm,
somebody who's sitting in the waiting room and you start giving out AI therapy apps and say, well, we don't have any therapists that are available right now, here's an AI therapy bot.
mm-hmm,
Yeah, that's going to be a problem, and I think that is something we should be
mm-hmm.
concerned about.
Yeah,
And I
yeah.
don't think you're going to find a hospital that does that.
Yeah, are you thinking at all, or your peers, the state representatives, talking about these big tech companies and how you can hold them accountable for this as well?
Of
Because
course,
as we know, I'm sure you know, we just had another one. I've been working with suicide prevention. That's my area of work, and we've already had 4 suicides in the US alone using chatbots, these general ones, not the ones that are say, oh, I'm for, an app for therapy. It's all the chat GPTs and Geminis. And are you thinking about holding them accountable as well?
Absolutely. The
How?
question that I'm asking, and open to your recommendations and anyone else listening to this, what should that line be? If we know, as you and I both know, that millions of people are going to be going to ChatGPT and Character AI and OpenAI, and they're going to be looking to large scale AI.
Mm-hmm.
If those large system AIs are going to be providing any kind of answers on where should I go play basketball today, which turns immediately into, I'm really depressed today.
Yeah.
I'm really thinking about committing suicide. What should I do?
Mm-hmm.
What first question is, should the law dictate what OpenAI says there or ChatGPT? And I don't know the answer to that. I'm not
Mm-hmm.
so sure that
We
regulation,
can give recommendation if they
I would love
contact
that.
us, believe me.
Yeah, but I mean, big tech really is obviously answering this question for itself, and I think that we have to have this national conversation about where do we draw that line? Do we
Mm-hmm.
draw that line as a
Mm-hmm.
legislator, as a law, or societal norms going to dictate what we can and cannot do? What
Mm-hmm.
about children? Right, where
Mm-hmm.
are those lines about access to AI?
Mm-hmm.
And I think those are open questions, and yes, we're absolutely looking at that and would welcome your ideas about it.
Mm-hmm. Yeah. Bob, why do this? Why write? Why sponsor this law? Anything specific, personal, maybe? Or
Nothing specific personal.
mm,
I've been interested in AI and healthcare for a number of years now. I was working on the ways that AI is being used to deny health insurance claims. And to
mm-hmm.
me, that is
It's
problematic.
absurd. Absurd.
And so I've
Yeah.
been working on that. And the National Association of Social Workers brought me this concept, and we worked together on that this spring.
Mm-hmm.
And this spring, it just exploded in utilization and the number of apps that are out there holding
Yes.
himself out as a
Mm-hmm.
therapist.
Yeah.
And again, to your point, just story after story of someone committing self harm.
Mm-hmm.
And that's why.
Yeah.
That's when you start talking about life or death. That's when I'm never going to hesitate to say the legislature, the government has a role.
Mm-hmm. Yeah. And many of you who are listening or watching on YouTube channel, you may be asking, why are we talking about Illinois? Right? Because that's how national laws sometimes are created, right? You have one law in one state and then another state contacts. So are you being contacted about this law by other states?
Absolutely. We've had this conversation with a number of states. We've watched other states take our
Mm-hmm.
law as a model and evolve and change and modify it.
Uh-huh. Mm-hmm.
California just passed a really broad based healthcare AI regulation bill that went way beyond therapy. Um,
Yeah.
and Nevada and New York and Florida and Utah, there are a bunch of states that are either already adopting these laws or considering them. And
Mm-hmm.
I think everyone accepts that this is so ubiquitous that we
Yes.
should at least talk about it and come up with a consensus. Ideally, this would be a national law, but I think practically speaking, that's
In the
not happening
States,
anymore.
it's never in the States, it's never that simple, is it?
Correct. That's right.
Yeah. How is the feedback from the public? What have you been hearing?
Every therapist I've spoken with is grateful for the law and
Mm,
very supportive of it. I think a lot of tech companies, there are those who are really explicitly the target of a law like this, so the AI therapy bots that are not
mm-hmm,
happy, and I get it.
mm,
Uh, Ultimately, I think they know what I'm trying to achieve here. And then
yeah.
there's also the large platform AI systems, which, as you noted, are really grappling with what should they be doing when they get
Mm,
confronted with somebody who is clearly a danger to themselves or others.
mm-hmm,
And that is a question that I think we're going to be grappling with for some
mm-hmm.
time.
Yeah. How are these? I have two more questions and one
Sure.
to finish. How are these apps? I'm just thinking with their minds now. They have a therapy app they've been using all over the states, and how can they even block people from Illinois? Because
I'm sorry.
they can be they can get like a violation, but it not
Yeah,
necessarily their
it's just
fault.
like when you start talking about internet activity, one that we can track who's marketing and targeting people who live in Illinois, but also the
Mm-hmm.
company has different restrictions. It's not unique for a company that's trying to sell, for instance, alcohol in one state and not another.
Mm-hmm.
That they
Okay.
track the residency of somebody who lives there. So this is not really a new issue. The tech companies certainly have a variety of different ways to validate the location of their user.
Yeah. Bob, we finished this podcast with one segment called One Last Question, and that's when we
Yeah,
get a little bit more personal. So
great.
my question to you is, you're a father of 3, right?
Two.
2? You're a father of 2. So what if one of your kids, when they're teenagers, how old are they now?
They're 8 and 10.
Okay, so we still have a little bit of time. What
Yeah,
if they come to you and say, Dad, I've been using this app here. It's really helping me. I've been struggling with a few things. I don't want to see a therapist. It's a therapy app and it's really been helping. Would you take that away from them?
yeah. The answer is yes. I think that ultimately, as a parent, we have responsibilities to make decisions about the well-being of our children while they're still getting older. And what you just said is very real. There are any number of children and young adults and adults who are seeking help and turning to any corner that they can and finding comfort in other ways. I've heard from a lot of individuals who have started to use these types of apps, and some of whom have found it to be very harmful, and some of whom have found it to be just the unique way to help them. And so this is not a binary question. It's another reason why we're not going after the user. It's not about that. It really is, let's find the ways that we can help people, but do it safely. That's really the biggest takeaway here.
So you would erase it from their phone?
Well, they're 8 and 10. They don't have it. Neither of them have their
No,
own
when
phone.
they say that, they will have their phone.
Yeah. Well, so they both have school-based AI programs. They know about the work I'm doing. But if it were to happen, absolutely, it's my responsibility as a parent to make sure that I'm keeping them safe. And that's what I would have done in that situation. Yeah.
Thank you so much for your time. I know you are so
Thank
busy.
you.
I've been trying to interview you
I
for a
know. I'm
few
so sorry it
months.
took so long, but thank you. Thank
Absolutely. Thank
you.
you for your time and your
Of
candor.
course. And you have a great day. We'll talk
You
soon.
too.